One. Welcome, everyone. Thank you so much for joining us here today. We're going to get started in just a minute while our platform's letting everyone in. You'll notice as you join, your camera's automatically off, your mic's automatically muted, but please feel free to use the chat box to say hello, give us a greeting. We'd love to hear where you're coming from today. And through today's session, feel free to use the chat box to share, to ask questions, to post resources, and communicate through there. We'll be getting started in just a minute here. I see our platform still letting some folks in, and I see those greetings starting to come through. Hello, hello. Feel free to use the chat to say hello and let us know where you're joining from today. Hi, everyone. It looks like we have folks all over. Wonderful. Wisconsin. I am also a Wisconsinite, even though I'm a national staff. Hi. Welcome, everyone. Awesome. Well, I know our platform is still having a few people trickling in, but I'm going to go ahead and get started with our introductions for today. It's great to see everyone letting us know where you're coming from. It's so great to have you joining us. Today's webinar is I'm Facing Housing Insecurity, Now What? And that is our topic that we'll be really diving into for the next hour with our fantastic three panelists we have joining us here today. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. I have just a few notes for everyone before I introduce our panelists. This webinar is being recorded and will be emailed out to anyone who registered within 1 week. We currently do not offer CEUs, but if you would like a certificate of attendance, we do have a form for you to request one of those. I'll post the link to that shortly here in the chat, and it will also be included in your follow-up materials if you're not able to access it from the chat today. As many of you know, and our backgrounds are letting you know, May is Mental Health Awareness Month. And this Mental Health Awareness Month, MHA is encouraging you and challenging you to examine your world and how it can affect not only your overall health, but also your mental health. So looking around and looking within from neighborhood to genetics and all the factors that come into play when it comes to your mental health. Our 2023 toolkit includes information about how an individual's environment impacts your mental health. It provides suggestions on how to make changes to improve and maintain mental health and well-being, and provides information on how to seek help for mental health challenges. And so I'll also post the link to that toolkit that can be downloaded for additional resources this month. Each week, we'll have a webinar that's coinciding with our topic for this year's Mental Health Month. And that's really why we are here today, is to focus on environment and our environment around us relating to housing and housing instability, insecurity, and homelessness. So before we jump into our discussion, I'd love to introduce our speakers so you know who we have with us here today. First, we have Cleo Martin, who joined Pathways to Housing in 2021 and currently works as a training specialist. Before this, Cleo worked as a behavioral health therapist at runaway and homeless youth shelters throughout the tri-state area. Cleo also worked for Project Home and assisted in the creation of the Gloria Casares Residence, which is the first permanent supportive housing for LGBTQ+ youth and young adults in Pennsylvania. Drawing from principles of feminist theory, Cleo uses a strength-based and person-centered approach to assist individuals in understanding and navigating various forms of oppression and how these systems impact one's personal and interpersonal experience. Welcome, Cleo. With us, we also have Ray Scott, who is a current social work student at The Ohio State University and graduated from Columbus State Community College with an Associate of Applied Science in Social and Human Services. He serves as an executive board member of Students with Psychosis and is a member of Mental Health America's 2022-2023 Young Mental Health Leaders Council, among other positions. He advocates for disability rights and collective care with a focus on peer support. Ray has lived experience with housing insecurity and homelessness and is very passionate about the intersection of this experience with marginalized identities and mental health. Welcome, Ray. We are thrilled to have you as a part of this discussion. And with us today, we also have Mary Jones, who is the president and CEO of Mental Health Association of South Central Kansas, and adjunct faculty at Friends University in Wichita, Kansas. She's developed community-based service programs for people with mental illness for the last 25 years. Her professional highlights include housing development for people with severe mental illness and seniors, and opening and expanding outpatient treatment programs, including therapy, medication services, and treatment for substance use disorders. Mary is the president of the Kansas Mental Health Coalition and chair of the Kansas Behavioral Sciences Regulatory Board. Welcome, Mary. And welcome to you all. It's really great to have all of you as a part of this panel discussion here today. And as we open up and start our discussion for the next hour, I would love to hear a little more from each of you about your connection to today's topic, whether that be personally, professionally. I know you each just got a big bio read about you, but what really is important for our audience to know about you and your experience coming into today's discussion?
Thank you, Jackie. I'll start us off and talk a little bit about my housing experience. For 11 years for the organization, I was able to work in the area of housing and homeless services. And in our organization, that looks like a variety of housing options for people with mental illness, and also community-based case management for those who are in need of housing or need of supportive housing after we find them housing. You know, one of the things I say all the time is housing is healthcare. And so when I think about how it is that we can impact someone's ability to have good mental health or to start a pathway of recovery, the key is a safe, stable housing environment. For a lot of the folks that we serve, that looks like it can be in group homes, it can be in short-term crisis housing, it can be in transitional housing, and it's also can be in permanent supportive housing. And for those, sometimes it's just reaching out and making connections to link them to other resources. So I'm really proud of our MHA and our history with putting housing at a central focus in our state, because it's just so critical to how people get healthy.
I think I'd just like to really echo that and emphasize the importance of housing and its implications for somebody's overall health and wellness. I really appreciate a harm reduction lens to housing our folks. And here at Pathways, we train other agencies kind of in an outward facing way about high fidelity housing first. So housing folks directly from the street, maybe with chronic homelessness histories, many with severe mental illness and substance use disorders, straight into their homes, many for the first time. It is super low threshold, not many barriers, other than them meeting that chronic homelessness criteria. And really meeting them where they are. And I think I appreciate it so much because if we think about it, as simply as possible, that is a solution to homelessness, right? Putting somebody in a home. There are a ton of other services somebody will need afterward, right? And supports there. And I don't want to make it seem like this is the solution to all of the issues, right? But into getting somebody from the street into a home, I think that the answer can be simple. There are a ton of resources that folks need, though, in order to do that. It's not a simple task, but is a simple solution, I think.
So I have my own lived experience with housing insecurity and homelessness, and I currently live in a transitional living program. I'm housed by a local LGBTQ center in collaboration with Huckleberry House. I also am a social work student, as was mentioned. I had a practicum through Columbus State at Star House, which is a drop-in center for homeless youth. And that experience combined with my own personal experience has made me really passionate about this topic and working with youth who have experienced homelessness in the future, and especially those who identify as a marginalized identity or have severe mental illness. I just recently had finished up a project that is kind of leading into my honors project for my senior year at OSU on youth homelessness and mental health, and just viewing homelessness as like a very inherently traumatic thing. I think that that's something that is key to understanding how homelessness impacts mental health. And I'm also advocate for just expanding the definition of homelessness and housing insecurity, because I know that for me, I've been in situations where while I was technically sheltered, it was unsafe. So I do think that that's important when we're talking about housing insecurity.
That's a great point, Ray. Thank you for bringing that up. And I'm going to sneak an extra question in here before we continue, because I think there can be confusion when we talk about homelessness and housing insecurity. And automatically our mind goes to an individual that has no shelter. And so really for our audience, can you also expand on what housing insecurity is and can look like, and how that can be challenging for individuals in their mental health as well?
Yeah, I can start with this. I know that there's a lot of different ways that housing insecurity can look. There's people who couch surf. There's people who are sheltered in like an abusive situation. There's people who are on the streets as well, or living in programs that are temporary and have that risk for becoming homeless again afterwards. I know that in my own personal experience and the peers I've met through my transitional living program, that there's a lot of dangerous situations that people can get in when they're housing insecure, such as like engaging in survival sex or stealing as a means to survive. Housing insecurity looks very different depending on the person and their situation, but it can be very dangerous and, like I said, traumatic.
I agree in pretty much everything Ray just shared on that note also. And I think there's going to be space to talk about some myths, but I think the idea that housing insecurity looks a specific way is one of those myths, right? Like this is what a homeless person is and what a homeless person isn't, I think can be harmful and damaging. And I think if we kind of broaden that idea, our idea of who is chronically homeless too, misses a whole bunch of folks, like Ray was saying also, right? It misses our folks who are couch surfing, right? Or living in environments that are unsafe, but are technically housed, right? Yeah, I agree with everything he's said so far.
Yeah, Khalil, thank you for bringing that up. And I think because you brought up the housing first principles, this is a great place to talk about how housing does look different for everyone, and putting client choice at the center of what the needs are to find whatever that looks like for that person or family that you're trying to work with. Because yes, there are things that look like obvious answers, but if you don't understand the complications with each person and what their struggles are, you won't really find that good, supportive, safe place for them.
For adding to that and just expanding on that for our audience listening, I want to talk about the connection between housing and mental health. And we know they're so closely connected. For anyone who's experiencing housing insecurity or homelessness, it's nearly impossible for that not to affect their mental health. For panelists with lived experience, and for those of you that have worked with individuals going through this, what did you find most beneficial, either for your mental health or for those you were working with while they were experiencing housing?
I'll start us off, Jackie. I think for me, when I look at my work in the housing sector, it starts with a Maslow's hierarchy of needs, right? And really considering if someone doesn't have a stable place to be, they can't work on anything else. You know, it's just so fundamental. And then I also think about how that is such a critical part to looking at social determinants of health, right? How is it that people can live healthy lives in other ways if this very basic thing is threatened day in and day out? So I think the framework for our organization has been, you know, that basics first, that people have to have stability, they have to have safety in all sorts of ways, physical, emotional, and otherwise, in order to be able to see that path forward.
I would definitely like to echo that. I think it's very important that basic needs are being met first. I know that in my personal experience, with a lot of the trauma that I went through living in an unsafe situation, even though I was seeing a therapist, I was not able to properly process that because I was still in that situation that was re-traumatizing me every day. And that's an experience that I know a lot of the other youth in my living program share. There's a lot of people who are housing insecure or have experience with homelessness who have been victims of crime as well. So I think that it's very important to make sure that the basic needs are being met. But also, I think that once you do get to that safe space, in whatever way that is, in whatever way you get housed, I think that in my own personal experience, when I've worked with the therapists and the social workers through my housing program, it can go a long way just to like take the time to listen, because I've been hospitalized before when I was seeking support with housing, and I never got that housing support, even though I was put through inpatient at that time. And the doctors at the hospital just did not, spend the time with me. They did not give me the resources I needed. And I explicitly had requested, I'm living in an unsafe situation and I really need help getting out of this. And they just had released me a week later without any support. So I think just like taking the proper time and really listening to the needs of the people that you're working with is very, very important.
Yeah, I agree with that statement also. I think there are many times where we're like, oh, we can't help this person. Right. And maybe the phrase we might hear is like they don't want help or they don't want to help themselves. Right. But in Ray's case specifically, he's been able to say, hey, this is what I need. Right. And I think it is an agency's responsibility to adapt to those needs, right, or refer out, connect with somebody who does. Right. And we're not just turning somebody away because we don't have what they are saying that they need, right? Because people aren't coming, they're not sitting across from a desk from us, right? Because they don't need anything. They are seeking support, right? And they've made it there to that space for some reason, right? It might not be for a reason that we can necessarily help with, but somebody can for sure. And I think that's important to know and hang on to also. And I think just to answer the question about what's contributed to my own mental health is, it sounds like really fluffy, but I think like empathy, right, and perspective taking is super important. I think about in my own mental health and well-being, how awful of a day I have at work when I haven't had a full night's rest at home in my bed, right, with all of my needs met. So to ask somebody to engage in like paperwork and documentation with me for over an hour is a huge ask for somebody who doesn't have those things and those needs met.
Absolutely. Thank you, Khalil. I think that's a great sentiment made that can be carried throughout our conversation today of that empathy and that understanding and that listening. And to Ray's point and Mary's point too, listening to the needs of the individual and then responding. And really when it comes to mental health, what's going to help them the most is finding safe, secure housing to eliminate that stress in that person's life. And so for them to be able to ask and let people know that that's a need for them also takes strength And so then to not have that ask be met with resources, support, answers can be so difficult. So thank you all for sharing. I want to get a little bit into some of the societal issues when we're talking about seeking help. And I think often we hear that term of help is available. And I know I've heard it a million times in the mental health world, and we hear it in situations when you're seeking housing or locating food or finding transportation. All of those things, we often hear that term of help is available. But really, what resources would you recommend to help individuals who are going through this, or as first steps for someone finding themselves in a difficult housing situation?
I'll jump in, Jackie. You know, it's interesting when we say these words that sound really simple, like help is available. And it seems logical to most everyone that you would say, okay, if I need help with housing, I can call a housing authority as such or something like that. But just based on the conversation we're having here, I think what isn't always understood are the traumas or the preconceived ideas about where you can get help, how you can get help. And really the complexity of systems. You know, we have really good services, but we make really difficult systems. I was thinking about that when Khalil was talking about, you know, certain criteria for certain housing programs, and that makes it really challenging for people to get help. So my first go-to for everyone is a trusted resource. So, you know, there might be a therapist or somewhere at a meal site or a place that someone has connected where they trust the information that's coming. You know, in our community, a United Way is a good resource. That isn't always true in every community, but I think it's going back to where can I find trust? And, you know, my hope is in that our community, if you call an MHA, we're going to do that very thing and get you linked up to the resources that you need. But I think it comes down to where you can get information that you feel good about.
Yeah, I think another helpful idea in like conceptualizing why people don't, or why we think that they don't, is because a history long, there are a lot of reasons, right, that folks will choose not to seek care because they've been treated poorly historically and as individuals, I'm sure. A story I like to tell in our own trainings when we're giving is I once had one of my wisdom teeth out by a dentist that I felt like was really rude, right? I didn't appreciate his care for me, and I didn't feel very safe with that dentist, right? So the rest of my 3 wisdom teeth, I got out somewhere else. But I think the fact of the matter is that the folks that we're serving don't typically have the supports to do that. I have a full-time job and health insurance support and a good like social network of people supporting me also, when we know that the folks that we're serving typically don't. So understanding and recognizing people don't return, or the chances of them returning to places that they've been hurt are not very high, right? And I think that thinking about it this way, framing it this way, helps to kind of take the onus off of that individual, right? It helps us kind of destigmatize, like, oh, they are lazy, right? Or, oh, they don't want that help, or they don't want that support. But I think also, in addition, I'd like to frame this question, maybe what an agency can do for people that they feel like they can't support. And I feel like it's really exiting kind of this silo, right? That all the services I can provide somebody exists right here in this space. Sometimes it's maybe thinking critically about who we serve well and who we don't, right? And maybe buffing up the work with the folks that we don't feel like we're serving well. Here at Pathways, we're located in Philadelphia. There are many other helping agencies in our area. And I think of 2 specifically, 3 really, that we're reaching out to on a pretty consistent basis to help us support folks because they specialize in these populations, right? One is Prevention Point Philadelphia. They're our local syringe exchange. Yes, we do harm reduction work and a lot of harm reduction talks and education, but they are providing the resource. So we want to get as many people connected to them as possible. And I think of the folks in the trans community also. There is Morris Home here in Philadelphia, who does work specific with trans people, and we're not going to turn them away. We're going to loop Morris Home into our care for them, saying, hey, we're not serving this person the best we can. We know you're really great at it. What can we do to make sure we're supporting this person in the best ways that we can? And also there's another organization, Philadelphia Fight. They do great work with HIV and AIDS diagnoses. We're constantly reaching out for them to support for our folks who might need more intensive medical case management and things of that sort, which is just super important to improving the care for our folks. I think it's easy to fall into the trap of, okay, everything you need is right here in our agency, right? And we kind of discount the great work that other folks are doing. So I think if we look at it more collaboratively, and as a kind of like a teamwork approach, right? We all hate that homelessness is a thing, right? And that our folks are exposed at increased rates to things like violence and assault in the community. Here are the people we can be reaching out to for support. I think identifying those within our agencies, I'm sure there are many service providers here in this space, is a good first step to kind of uncovering who am I serving well and who am I failing to serve and who can do it better. It doesn't have to be an individual agency's fault that they're not serving a specific population to the best of like meeting all the needs that a specific population needs, right? But chances are somebody is and can support you with that.
For me, it really started with just like reaching out to a trusted professional and letting them know about the situation that I was in. And, you know, talking about these societal issues, I do really want to highlight that it's especially difficult for people who live in rural areas, people who are people of color, people who are in the trans community who can't like go to a traditional shelter. I know that was a barrier that I faced. There's no shelters that are accommodating for trans people near me. As well as people who have like severe mental illness and the stigma that comes with that, people with psychosis, people with bipolar disorder. I know that I've faced a lot of discrimination trying to seek support, and that can be a real issue. So I would really encourage the people who are in the chat or watching this who are professionals, whether that's in mental health care or a related field, to really take the initiative and reach out to the people that you're working with, making sure that you are aware of what they're going through and supporting them to the best of their ability. It can be really hard to take that initiative first when you are in such a difficult situation.
Yeah, can I add to that? I think another thing that I think we hear a lot about, we've talked about people not wanting help, right? Or that lazy kind of perception. But really, if no one's ever, I think what I hear a lot, and that feels really discouraging, is that I don't want to help people who don't want to help themselves, right? Which is, of course, just the furthest thing from the truth. And I think we hear that in the story that Ray is sharing with us now, right, about his own lived experiences, is that, of course, I want help, and that's why I'm here, right? That's why I'm reaching out to these people, but they're not providing me the support that I need or that I'm explicitly asking for. Yeah, I just wanted to highlight that. And I think when we say that about folks, I don't want to help people who don't want to help themselves, is really damaging and harmful to the folks that we're serving. And I think there are some other things that are underneath that, right? Maybe some symptoms of burnout or vicarious trauma, right? Because we didn't come into this profession, in this field, to kind of move around the world in that way, right? And engage with our participants in that way. But I think once we are exposed to so many kind of maybe not successful outcomes, right? And pain and hurt in the folks that we're serving, this can be an attitude that we adopt that just isn't very encouraging or helpful, right? And can be a barrier to folks receiving the services that they need.
I just really want to emphasize that I know that that's such a common misconception that, you know, people who are experiencing homelessness or housing insecurity don't want that help, or they're not, you know, actively seeking that help. But I mean, first of all, some people may not be aware of the resources that are available to them. But then also, you know, when you are struggling through something that is traumatic, it can be really hard to like get the motivation to do things. So I don't want to frame it as something that is a individual fault. I don't think that's true. I think it's a societal issue. And you know, all the people that I've met through my transitional living program, they're actively trying to work, whether that's on their education or on their mental health. But when you are homeless or housing insecure, accessing those resources to help you climb up that ladder is really, really difficult. So I think that it's really important that providers are reaching out and taking that initiative.
Um, I'd love to kind of dig more into that topic that each of you started to bring up of those common misconceptions of individuals who are homeless or experiencing housing insecurity, and what some of those most common misconceptions are that can really have that negative impact on the mental health of those who are trying to seek stable housing.
Well, in our community, like so many, there are, there's sort of a problem of homelessness and unhoused people, and that gets people's attention, business leaders, city folks. And I think the thing that's most troubling is there's just this belief that, those with substance use disorders have sort of created their own problem here, or those with mental health disorders just, they don't want the help, those kind of things. And I think this is a really good opportunity for us to talk about, yes, there's a high co-occurrence of substance use disorders with mental health disorders. We know that. But the idea, that stigmatizing idea of choice, that people are choosing this over a nice place to live and the resources that would support them. There's just so much, there's so much stigma in a homeless situation above and beyond what we face with advocating for mental health and substance use disorders in isolation. When you put those things together, it's like that stigma and that prejudice grows exponentially, and doesn't take into account, again, the individual factors and complexities that so many people face. And the reality is that many people are precariously housed and not considered homeless. Many people are one paycheck away from something traumatic happening to change their housing situation. And I think until we can have open dialogue, taking blame out of that, we'll combat this for quite some time.
I have a note on this one paycheck away idea, right? And data tells us that 2/3 of Americans, so close to 66%, I think maybe closer to 67, can't afford a $400 emergency. And I think when it comes to, what is the myth here? I think it's that we are so far away from homelessness, right? If that is the majority who are $400 away from maybe the difference between being housed and being unhoused, we are not super different than the folks that we're interacting with, I think, in the workspace. And I think that that's really helpful in just navigating the interactions that we do have in the workspace. I think that another kind of misconception is that helping professionals who are doing this work, right, we're uncovering our own implicit biases, right? We're working to destigmatize. This is making us better people, right? And sure, they might make you better human beings, right? But the reason that we're doing this is to serve the folks that we're serving in a way that is healthy, in a way that is not causing more harm, right? Because we've heard already that experiencing homelessness is an inherently traumatic experience, right? So we're not learning these things for ourselves, right? In our own, like, glowing, here's my implicit bias certificate, I am very culturally humble now, right? We are doing this to serve the folks that we serve better in a way that is not doing more harm. Yeah, I think that another common myth is that the folks that we serve, or folks who are unhoused or experiencing severe mental illness, are dangerous. One of the things that we do know is that with the increased vulnerability of the folks that we're serving, is that they are more likely to be the victims, right, of violence and violent crimes than the perpetrators of these crimes too. And I think that myth is one I'd really like to hit home and emphasize here in this space.
Yeah, I want to echo that idea that being unhoused or being in poverty even is like a choice, because it's not. People think that, that there's people who just want to get their SSI check and live off that and not have to work. But in what I've seen, most often you're living in poverty, you're not able to access the resources that you need, let alone the things that you might want when you're living off SSI or SSDI. So it's not a choice, but I also think that it's important to there's this idea that of deserving, and that people with serious mental illness especially are not deserving if they do not act a certain way, if they are not quote unquote grateful to the people who are helping them. And I don't think that that's a productive mindset to have. I think that everyone deserves to be housed. Everyone deserves to be safe and healthy. And I don't think that it should be something that is like gate kept, whether that's just like by not necessarily restricting their access to resources, but like emotionally as well. I think that it's important that we are empathetic and kind with each other on all fronts. And then I also wanted to say about that note of being dangerous, that really ties into like crisis intervention for me. And I know that a lot of the peers I've met who have experienced homelessness, and in my own experience as well, there have not been like emergency resources when it comes to things like suicide attempts, overdose, etc. When you're in that situation where you don't have support or you don't have resources. And I just wanted to mention that because I think that when it comes to people who are experiencing substance use disorders, I think there's especially like a lot of stigma there, that they are like lazy or unmotivated, or just not willing to get better. And that's not true in my experience. It's just like the lack of resources that has been interfering with people's ability to make progress.
Thank you, Ray, and thank you all for sharing. I think there were so many important points brought up through that discussion that are so important for everyone on this call to realize, for individuals who might be experiencing housing insecurity or homelessness at this moment, or for those that work in an area where they are engaging with those individuals, or just as a community member, to remind yourselves of those things as well. So thank you all for sharing. I know as I've been peeking through the chat and keeping an eye on things, it seems like we do have quite a few individuals joining us today who are either peer support specialists or those in a supportive role. And so I'd love to hear from you panelists for those that are joining us here today that might not be personally experiencing housing insecurity or homelessness, but maybe someone that they work with is, someone that might be a loved one that they suspect is. What are some of the signs that someone's experiencing this if they have not yet reached out for help? How do we kind of best approach them and provide helpful support?
I think that by the time somebody who has been housed for a majority of their life is kind of on the brink of being unhoused, folks would know, and folks would hear about it in their closest kind of social circles. I think something to be mindful of is how folks are asking for support and how folks are asking for help, because maybe they're not saying, hey, I'm about to be homeless, right? It might look a little different. Hey, I need some money for food, right? And I think it's really believing that somebody is struggling when they say that they're struggling, because I think that might be the biggest issue. Not that folks don't know. I think when we have relationships and families who are engaging with one another, we know when folks are struggling. But I think uh, our willingness to kind of help, I think, might be kind of the biggest barrier there, and maybe our own kind of denial of somebody's experience or what we think they should be doing to avoid that might not be the most helpful thing in the moment, right? So I think having conversations where folks feel safe and making sure that they feel safe, and if we're going to offer anything, that we know we have that resource to offer. If we have an extra room or a bed or something temporary, that folks are aware of all the stipulations there, right? I have this room, but it's for a week, right? Folks need as much information as possible, I think, when thinking about next steps and where they're going to be housed. I do think that homelessness is difficult to hide. I think many times when folks are new to experiencing homelessness, they might have exhausted some resources, which is, I think, why it's hard to ask for help.
Yeah, I agree with that. I know that in my experience, I was actually like ashamed of my situation and I didn't want to ask for help at first. And I think that other people can relate to that. I mentioned some behaviors that people might engage in earlier, like survival sex and shoplifting. But there's also, other things like, asking for money from friends, or if someone is struggling with like hygiene, things like that, you may notice these signs and they may not be asking you for help. They may be actually withdrawing from you, but there are like signs that you can notice. I think that it is difficult to like completely hide that you're struggling with something like homelessness, because it's just such a huge thing that just encompasses so much of your life. I do think that there are signs to look out for, and I encourage you all to be just actively like reaching out to your friends and family and making sure that they're okay. I think that it's really important that we look out for each other.
I think it's almost like going back to those original things we were saying when we started this call. It's about listening and having empathy. And, I think for a lot of people, Ray, to your point, there is a shame associated with not being able to pay your housing bill, whatever that is, whether that's rent or mortgage or whatever. And I think sometimes people will ask for other things or maybe note that other areas aren't as strong, but hiding that fact because who's going to come up with your rent, right? And so I think the more comfortable we get with listening for those cues and asking questions, are you in stable housing? Do you feel insecure about your ability to pay rent this month? The more open dialogue we can have that's destigmatizing and just there for listening and help and resources, I think the more we can gain from people.
Thank you all for that perspective and suggestions. I think they're helpful for everyone on the call today. I know we have a little bit of time here left before we have to wrap up, and I want to go to a few questions that have been asked in the chat, and also just elevate a few different things that have been shared in there. I know at one point people were putting in resources talking about 211 and 988, and those are some great resources. If your area has a 211, I know there were a lot of questions about that. That's a number. If there is a local 211 in your area and you can search that, then you call that number and they're often able to refer you out to different resources available right within your community for a variety of things, including housing insecurity, mental health, food insecurity, and those types of things. So that's a good resource. Thank you for sharing that, those of you that did. And also 988 is our crisis line. That's a national number for mental health crisis and mental health help that you can call as well. I know some of you, if you're joining as a housing organization, have been sharing your information, and I encourage you to do that in the chat. We would love for you to share in there your resources, your website, anything that you'd like to share, because as I'm looking at our participants, we have folks from all over the country. And so someone that's listening, you might have an organization and opportunity in their area that they didn't know about. So feel free, as we're continuing the discussion through our end of time here today, to provide resources in the chat. We would love for you to share those. One question that was brought up that I wanted to elevate for our panelists, that kind of goes along this line of what we were previously speaking about in our last question, came from an individual who asked, what do you say to someone that is housing insecure but not homeless, living in unsafe or unmaintained housing but feels there's no other options? That individual said that someone is me. I'm a CPRS and I haven't had access to resources and haven't found anything. I work but can't afford anything else and don't qualify for HUD. So for individuals in this kind of in-between space where they are not homeless but experiencing that housing insecurity, and I know, Ray, you mentioned, you've been in that situation, in a real unsafe housing situation. What would you say to this individual experiencing that?
I would say that, there are definitely still resources out there for people who are in these situations, but may not qualify for others. But then I also want to emphasize the need for more resources for people who do not meet traditional definitions of housing insecurity, or people who, are at that income threshold, or people who are aging out of transitional living programs, et cetera. There's a lot of situations where we need to establish more support. I think that that's really important. But I would want to say specifically to this person who is in this situation, I just want to emphasize that, it's really important to not give up. There are people who care. There are people who will be there for you. So I encourage you to reach out. If you have the 211 available in your area, that's a great place to start. I know how hard it can be to be living in an unsafe situation, but this is not your entire life. You can get out of there. It's really important to me that you keep that sense of hope. I just know that, back when I was in that situation for years, I just felt so hopeless and defeated. And I didn't even know that there was another option for me. I thought, if I never got out of this situation, I might die in a couple of years, honestly, because I just felt so hopeless. And so I just really want to say to you, please not give up. It's really important, and you are worth it. You are worth the effort.
I'd like to add on to some of Ray's comments. I think this is why, as housing providers, our job of advocacy never ends, because we don't want to think in just a straight line of this means more housing. More housing is part of that. More resources are part of that. Opening up legislative pathways in order to make change in your systems so that a person like this individual doesn't end up in that homeless housing situation. Instead, we can intervene early. The ideas of working on social determinants of health is important from a prevention standpoint, because eventually, if we can have the right resources and supports early on, people may not be finding themselves in some of these situations.
I also, in that question, it sounds like someone has some letters behind their name, maybe a peer recovery specialist. And I think organizations who employ folks of this profession and background, or I would hope that they also have resources to support folks when things aren't going so well. And by that, I mean, maybe structures in place like FMLA, where if you need time away from work, so that you have a place to live and can seriously think about and navigate all these systems that will require you to check in during work, right? And to do all these things during the work day, which impacts your income, right? I think speaks to the barriers. But I think checking in about what resources might be available at your agency so that you can focus on that specifically. Yeah, I'm sorry to hear that you're going through that and are employed and doing good work, it sounds like.
Thank you all for sharing. And I know there was an outpour of love and support to this individual who's experiencing that right now. And so thank you for reaching out and asking that question here today. Another question that was brought up and elevated by a few other individuals is, what do we do when there is a long waiting list for housing and shelters in our area?
Well, that sort of goes to my previous answer, is that this is a reality, I think, in so many communities, is wait lists and then people who just can't access anything in the meantime. From my standpoint as an organization and housing provider, it's my job to advocate and to continue to develop resources locally and at the state level to ensure that we have resources available for folks and abilities to place them. And there's not enough resources. I mean, it's very clear. Our community is not different than other communities across the nation, is that the work in advocacy and policy has to be front and center so that we can help this problem.
Thank you, Mary. And again, I know that it can be so challenging when it seems like there are limited resources, and the reality is there are limited resources. And that's something that many organizations are working to overcome and is a constant barrier. So I appreciate everyone who is sharing their resources in the chat. And sometimes there are things in your area that you might not know of, or something that can help you get connected in other ways. And I know someone had also put in the chat elevating that you don't need to be suicidal to call 988. And that's another great reminder that it is a crisis resource. You can call if you are struggling with serious mental health or a mental health crisis. And a lot of those resources too, like 211 or other hotlines in your areas, you can call and be connected for a variety of reasons. And we also encourage those warm lines. So there's warm lines. I can include all of these lists in your follow-up materials, but the warm lines are in many states and many areas that individuals can call who are experiencing mental health stress or distress, but might not be in the form of a crisis, or they might not be suicidal at the moment, but they're needing support and help. And those warm lines can help you talk through what you're going through and get you connected to needed resources in that moment and within your community. So we encourage the use of those as well. I know we're getting close to our hour, but there was one more question in the chat that I'd like to elevate if any of our speakers want to add on to this. And someone had asked about substance use disorder, which I think is important to bring up in this conversation too. And they had said that often in society, substance use disorder is mostly viewed as a criminal justice issue and not as often a health issue. And how does this affect people experiencing homelessness or housing insecurity that also have a substance use disorder?
I think to answer the question on impact is it impacts them negatively, right? These folks aren't being housed or being housed in programs where they're required to maintain some form of abstinence, right? And then we have the issue of maybe someone presenting with a substance use disorder, right? And are maybe seeking help and support, but then also penalized and receiving additional consequences when the behaviors they presented for are the behaviors that they continue to engage in, right? So we're turning folks away from services who are presenting for the same exact services that they're asking for and likely need. Yeah, I think that you're outlining a huge barrier, right? In that there are substance and abstinence kind of requirements to be housed. And I think that speaks to the idea of needing to be deserving of housing, right? You need to not use any substances, right? Not engage in any risky behaviors, to be deserving of a home and safety.
I immediately go to resources again, that this is something that we can advocate for in our states and at the federal level, block grant funding to pay for people for their substance treatment that cannot afford substance treatment. It takes me into mental health parity. It takes me into all these other areas where I think we have to be front and center to say, people do want help. There's just not the resources available. And our community, I'm sure like many others, the wait lists are very long for people to get substance treatment when they don't have an ability to pay. So it becomes a charge to us all again for advocacy work.
Yeah, I want to echo the importance of advocacy work. I know that, in my own experience, harm reduction is something that was actually life-saving for me. So I think it's really important to have a focus on that when we talk about substance use disorders. That project that I mentioned that I'm working on for my senior year at OSU, I found out that, a lot of, well, it was specifically youth in this study, but it might be applicable to adults as well, who were coming out of our incarceration, did not get linked with the resources they needed to like reintegrate into society. And so they ended up on the streets. And so that's a big issue. And I just think there really needs to be a focus on like ending that stigma of well, for people with substance use disorders, but also people who have been incarcerated in general, who cannot access some of the same resources that other people might have. And so I think it's really important that there's proper support there, and we're not there yet. So I think that's where I would echo on the importance of advocacy work.
I think what's helpful for that advocacy work is normalizing what we kind of view as risky behaviors, right? And understanding that we all engage in risky behaviors, right? But the behaviors that the folks that we're serving are engaging in are much more stigmatized than the things that we are doing, right? I think about driving without a seatbelt, maybe speeding, right? If you drink socially, right? These are all additional risky behaviors that are just less stigmatized than the behaviors that our folks are typically engaging in. But not necessarily less dangerous all the time, I think is what I mean by that.
Absolutely. That's a great point, Cleo. And I know as our time is wrapping up, that's a big theme of our discussion today is that stigma. And the stigma in these discussions when we're talking about social determinants of health and things like housing insecurity, homelessness, food insecurity, all of those things that impact our health and ultimately our mental health, is that there's so much stigma behind them that it becomes challenging to have these discussions and address it. But that's why these discussions are so important, to try to combat that stigma, and for everyone watching to be able to have these kind of discussions within your communities and within your businesses and organizations. And I saw a few comments in the chat echoing that, of the importance of the organizations that are here today, that are housing organizations, being able to communicate the work they're doing and the people that they're serving to others in their community, to start to break down that stigma around the individuals that they are serving. Because as Khalil mentioned earlier, we're so much closer to being in that position than we realize, and so many people are. And so I thank each of you for being here and bringing that perspective today, for talking about the stigma, for talking about the importance of asking for help, providing help, being that support in someone's life. And I just am grateful for such a great discussion we've had here today with so many connections. And thank you to everyone who's joining us. We appreciate you being here, for sharing, for asking questions, for being vulnerable, and providing everyone with an abundance of resources as well. So just a few reminders before we wrap up. It is being recorded. We'll email this out to everyone within a week. You'll have the recording, and I'm also going to compile a list of the resources put together in the chat so that that can be sent out to you as well. And our speakers have some resources that we'll share with you from their organizations. So we really appreciate you all being here today. And Mary, Ray, Khalil, thank you for leading this incredibly important discussion during Mental Health Awareness Month.
Thank you.
All right, wonderful. Thank you, everyone. Thank you for being here. We will be in touch soon with all of those follow-up materials. Have a great rest of your afternoon.